Hello friends, welcome to my channel Dr. M Files. Today I am going to teach you the complications of acid-base disorders, and we will also discuss how to report the ABG and the questions related to this. So the complications we will start the complication with the lungs. So there are two types of disorder like we studied in the previous lecture, that is acidosis and alkalosis. So what happens in the acidosis? There will be an increase in PCO2, we have already discussed that. So since the PCO2 has increased, the body will compensate to decrease it. So it will try to decrease it. So for decreasing, what it does? It increases the respiratory rate. And how will it increase the respiratory rate? It will start hyperventilation. So since hyperventilation takes place for very long time, so what happens? There will be fatigue. So fatigue will take place. Now conversely, in alkalosis, the PCO2 will decrease. We have already studied in the previous lectures. So when the PCO2 will decrease, what the body will compensate with? It will try to increase. So how will it increase? It will start retaining carbon dioxide by decreasing the respiratory rate. So what will happen? There will be hypoventilation. Correct? So when there will be hypoventilation, there will be a decrease in oxygen level, and that will lead to what? That will lead to hypoxemia. Okay. So now this clear the complication with the, let's discuss the complication related to the heart. So what will happen in the cardiac complication? There are two conditions what we have already discussed, acidosis and there will be alkalosis. So what happens in the acidosis? There will be increase of H plus ion, and that H plus ion and that acidosis will affect the cardiac muscles. So that will lead to decrease the contractibility. So once the contractibility will decrease, what happens? There will be decrease in cardiac output, and so decrease in BP, and will lead to hypotension. Correct? Again, now the H plus ion has also effect on smooth muscles of blood vessels. So what it will do? It will do the vasodilation. So vasodilation will lead to decrease in total peripheral resistance. So once the total peripheral resistance is decreased and there will be a vasodilation, what happens? There will be decrease in volume. So what will happen when there will be a sudden decrease in total volume? That will lead to the hypovolemia. And hypovolemia finally lead to what? Shock. So the acidosis may lead to hypovolemic shock. Now what happens when there will be decrease in the cardiac output and decrease in BP? The heart will try to compensate by increasing what? By increasing HR, heart rate. So once the heart rate will increase, it will increase in such an extent that it will lead to the irregular rhythm, and irregular rhythm will finally end up in what? It will end up in ventricular tachycardia. So VTAC. So VTAC will be the complication of acidosis. So now what are the PG questions or need PG questions? That will be acidosis will lead to what? Increase in H plus ion, which we know from the previous lectures. It will lead to what? It will lead to decrease in cardiac output. It will lead to hypotension, and it will lead to vasodilation. It will lead to decrease total peripheral resistance, and finally end up in hypovolemic shock and ventricular tachycardia. I hope it's clear. Now let's move to alkalosis. what happens in the alkalosis? Alkalosis will lead to vasoconstriction, will lead to increase in total peripheral resistance. So that total peripheral resistance once increases, there will be exertion on the heart, and that exertion will lead to again irregular rhythm. Why? Because the heart has to increase the HR, heart rate. So irregular rhythm will finally end up in what? It will end up in ventricular tachycardia. It can end up in ventricular fibrillation, and it can end up to supraventricular tachycardia. So what is the question expected? Alkalosis will lead to vasoconstrictions, it will lead to increased total peripheral resistance, it will lead to irregular rhythm, which will end up in ventricular tachycardia, ventricular fibrillation, and supraventricular tachycardia. So these are the complications of the heart, or it can also be, in other words, we can call cardiac complications of the acid-base disorders. Now let's discuss about the complication related to the blood vessels. Now there is two conditions as we discuss: acidosis, alkalosis. Okay. So acidosis will, what will happen? There is a intracellular fluid inside the cell, and there is a extracellular fluid here, ICF. So in the ICF, the H plus ion will increase. That's acidosis, we know that from the previous lecture. And since body will try to decrease the H plus ion in extracellular fluid, so that will shift to the ICF. So once the the H plus ion will shift to the ICF, what will happen? It will take away out the potassium ion. And we know that the potassium is compensated by sodium. So H plus ion will continuously going inside the cell, and potassium is coming out of the cell, and sodium is also going out of the cell. Now what kidney does? Kidney will start eliminating H plus ion. We know that because it has to decrease the acidosis and tend towards the normal pH. So it will start decreasing the H plus ion by eliminating it, and it will start retaining potassium ion. So what happens overall in the body? Overall happens that there will be increase in potassium ion, and there will be a decrease in sodium. So it will lead to hyperkalemia and naturally hyponatremia. Now what happens in the alkalosis? Conversely, the H plus ion will come out of the cell to the ECF to increase the H plus ion to balance the alkalosis, to make the pH towards the acidosis. So H plus ion will come outside the cell, so it will start coming outside the cell, and the potassium will go inside the cell, and again the sodium, to balance it, start coming out of the cell. So what happens then? There will be increase in sodium ion, and there will be decrease in potassium ion. That will lead to what? Hypokalemia and hypernatremia. So the questions are, in acidosis what happens? Hyperkalemia and hyponatremia. In alkalosis what happens? Hypokalemia and hypernatremia. So I hope this is clear to you. So let's discuss about the ABG reports. So to know the abnormal values, we must understand the normal values. So I have written here some normal values. So normal pH is in between 7.35 to 7.45. Partial pressure of carbon dioxide is 35 to 45 mmHg. Bicarbon is 22 to 24 millimole per liter, and anion gap is 10 to 14. There is three terminology here. One is the full compensation, the other is partial compensation, and there will be no compensation. So what does it mean? Actually, full compensation means when there is acidosis or alkalosis, there is a compensation going on in the body. So if the compensation going in the body and it brings to the normal pH, that will be a full compensation. Partial compensation is what? When the compensation is going on, but the pH does not come to the normal range. So it is partial, and no compensation means there is no compensation, pH is not in the normal range, and there is no compensation, either is metabolic or respiratory. So I have got few reports here from the ICU, and I have, for my convenience, I have written here. So these reports are written here. So let it keep it on the place, and we will discuss the ABG reports. So there is a formula called ROME. ROME is respiratory opposite, metabolic equal. So we will check here which type of acidosis by using this formula. So let's discuss the first report. pH. So pH is normal or increase? It is normal, but it is towards which side? Alkalosis. So the pH is increase. What about the PCO2? It is increase. What about the SCO3? It is also increase. So if you look at the formula, respiratory opposite, metabolic equals. So this formula, using this formula, you can see that it's a alkalosis, and which alkalosis? Metabolic alkalosis. Now we check that whether the compensation is going on or not. So for alkalosis, how does body compensate? By retaining carbon dioxide and so the increasing partial pressure of carbon dioxide. So partial pressure of carbon dioxide is increasing here or not? It is increasing actually. So it is increasing. That means compensation is going on. Now we have to check whether it is full or no compensation or partial compensation. So like I told you earlier that the PCO2 is increased in such a fashion that the pH has brought to the normal range or not. Yes, it has brought to the normal range. That means the compensation is full. So it's a full compensation. So what is the diagnosis? Metabolic alkalosis with full compensation. Now let's come to the second report. How about the pH? pH is decreased, pH is low, PCO2 is high, and HCO3 is normal. Okay. So if we look at this formula, respiratory opposite. So this is applying here. So respiratory opposite, that means it's a acidosis, and which acidosis? Respiratory acidosis. Now we look at the compensation. What about the compensation? Compensation will be done by the kidney by decreasing or increasing HCO3. Okay. So here acidosis, that means the kidney should retain bicarbonate and increase the bicarbonate to compensate towards the normal pH. But here if you look at the bicarbonate is normal. This means there is no compensation going on. Why? Because bicarbonate is normal, it's not increased, and pH is also decreased. That means it's a no compensation. No compensation. pH is low. So the pH is low. PCO2 is technically low. HCO3 is low. So in that case, if you apply this formula, respiratory opposite, no. Metabolic equals yes. So acidosis, and it is metabolic acidosis. Now, I have told you in the previous lecture that metabolic acidosis is always associated with what? It's always associated with anion gap. So we have to calculate anion gap. It could be NAGMA, that is a normal anion gap, and it could be a HAGMA, high anion gap metabolic acidosis. So if we calculate here, so this will come to, if we add this sodium and potassium plus and chloride and bicarbonate, so anion gap will come to 12, which is a normal anion gap metabolic acidosis. So the diagnosis is what? Metabolic acidosis with a normal anion gap. Now you have to see my previous lecture to check what are the diseases and the condition associated with the NAGMA. Okay. Now we have to check whether the compensation is going on or not. So let's find out. So pH is low, SCO3 is low, metabolic acidosis. Technically, when the SCO3 is low, acidosis is going on, then PCO2 should be low. Why? To eliminate carbon dioxide from the body by doing hyperventilation. So the PCO2 is low or not? It is low actually. It is low. It's on the lower side. But has it brought the pH to the normal range? No. So the pH is not in the normal range, but the compensation is going on. That means it's a partial. It's a partial compensation. So what will be the diagnosis? That will be metabolic acidosis with partial compensation. Okay. So the full diagnosis will be metabolic acidosis with normal anion gap with partial compensation. Now let's come to the point to the fourth report. So the fourth report, pH is low, PCO2 is low, SCO3 is low. So if you look at the condition, pH is low and SCO3 is low, metabolic equals, so this will be metabolic acidosis with, now we have to calculate the anion gap. So if we calculate the anion gap, if you add up sodium and potassium and subtract the chloride and bicarbonate, so anion gap will come to the 36, which is what? This is nothing but HAGMA, high anion gap metabolic acidosis. So again you have to look for the disease and condition associated with the HAGMA. So the diagnosis will be metabolic acidosis with high anion gap with partial compensation is, or full compensation or no compensation, we will calculate now. So here SCO3 is low, pH is low, metabolic acidosis. So in that case the PCO2 should be ideally low to eliminate the H plus ion from the body. So PCO2 is low? Yes, it is low. Now pH has become normal? No. So it has not brought the pH to the normal range. That means the compensation is still going on, or it will continue till the pH will become normal. So it is again a partial compensation. So the full diagnosis is metabolic acidosis with high anion gap with partial compensation. Now let's come to the fifth report. So pH is 7.38. Is it normal? It is actually normal, but it is towards the higher range, alkalosis side or acidosis side. It is acidosis side. So the diagnosis will be acidosis. So the pH is low, PCO2 is high, and SCO3 is high. So if you look at this formula, respiratory opposite. So PCO2 is going opposite to the pH. That means respiratory acidosis. And let's find out whether the compensation is going on or not. So to increase the pH and to decrease the PCO2, what will happen in the metabolic compensation? In metabolic compensation, the HCO3 or bicarbonate should be high. So it is high. It's on the higher range. So this is, but has it brought the pH to the normal range? Yes, to the normal range. So it is respiratory acidosis with full compensation. So I hope you guys have understood the ABG reporting, metabolic acidosis, respiratory alkalosis, metabolic acidosis and alkalosis, compensation, no compensation or partial compensation. You all understood that. Next lecture we will study, or we will discuss the case studies based long answer questions, short answer questions and multiple choice questions. Thanks for your attention. Have a good luck.